Hello humans, thank you for joining me for another episode. Today's topic is going to be sciatic nerve pain. I'm going to demonstrate and educate you guys on 3 exercises that help relieve and kind of like bring the radiculopathy that you may be having into the leg from the sciatic nerve pain back to the center point and the root cause of the nerve pain. Majority of sciatic nerve pain occurs due to being overflexed or overarched. So too much flexion or too much extension, and then what that causes, the bone structures will pinch a nerve. That pinched nerve doesn't get the blood flow, and all of a sudden that pinched nerve doesn't activate the muscles for locomotion and movement. So muscles get the activation via the nerve. So if you're having radiculopathy, which is a fancy term, is pain shooting into the leg, and it could go all the way down to your foot if you have extreme radiculopathy. So there's nothing really wrong with your muscles or your bones, but there's something wrong with the nerve being most likely compressed via too much flexion or too much extension. This video is really devoted to showing you guys how you don't need surgery. It's not invasive, and this should be the first protocol to relieving that sciatica nerve pain and getting you back to normal before doing any kind of surgeries or invasive procedures. These 3 nerve glides have been shown to help smooth out the sheath of the nerve that is getting compressed. So the idea here is we're not going to be able, there is no stretching of nerves. So if anybody educates you need to stretch your nerve for sciatic back pain or sciatic nerve pain, that is totally incorrect. Once your body matures and your nerve sets, there's no moving the nerve. It's the same thing as you sticking your finger in an electric socket. You're going to get shocked. So anytime anybody touches any kind of nerve, you usually have a response. But what we could do is the sheath, which is like a pillowcase analogy, your pillow, and then there's the pillowcase. The pillowcase can sometimes be wrinkled due to the compressed skeletal structures that via spine or pelvic, and along the way the sheath gets wrinkled. So we're gonna smooth out the sheath. We're going to return the nerve pain back to the localized part of the back, and hopefully you feel better. Sciatica's origin is in the lumbar spine, and then it shoots down into your right glute and into your left glute. So the origin of the nerve, the majority of nerves comes from the back, and it's like a branch. It branches out into your legs laterally, medially, and basically it engages the muscles. These 3 exercises are to relieve the shooting pain via nerve pain that you're having into your legs. You may need to do this multiple times throughout the day, multiple times throughout the day, but also consecutively and routinely, so you feel all the nerve pain that's going into the leg comes right straight into the low back. And then that's a totally different case where you need to establish stability in the pelvic and lumbar regions. But in this video, we're going to focus on eliminating the pain that you're having into the leg, into the calf, into the foot. So if it's into the foot, that's really extreme. We need to get it back to the calf, into the hamstring, into the butt, and then localize it into the lumbar spine or wherever it's shooting out of. I like to give a cable analogy. Your TV is not getting the signal. You're hitting the TV. You're trying to play with the cord in the back. But the main issue is the electricity that comes from the cable from the line via whatever server you have is not getting to your TV. So you can hit your TV all you want. You're not going to get the picture to come up. But what you need to do is call Comcast or some kind of main server to make sure that that signal is getting sent to the alley, into the alley, to the house. There's nothing wrong with a TV. So majority of times when people have sciatic back pain, there's nothing wrong with your muscles. There's nothing wrong with your skeleton. Well, there is something wrong with your skeletal structures because you compressed or you overextended, and then that nerve got pinched. And then when it gets pinched and it stays pinched, hence why the nerve pain is getting lower and lower into your foot. So when the nerve pain occurs, then the muscles can get the electricity to engage. When you're moving, you're not using the right things. You don't have the correct activation. And also the muscles don't get the oxygen they need. So I wanted to devote this video and show you guys 3 fantastic nerve glides that hopefully can eliminate and remove that tingling and numbness from your leg back into your low back. And let's get started. They're really simple. There are 3 simple nerve glides. You're going to be supine. Now let's get started. Very simple. First nerve glide is, which all of 2 out of 3 will be on your back, and the third one will be seated. First nerve glide is on your back. What you're going to do is you're going to start with your foot down, and when you extend your knee, you're going to point your toe up, and then you're going to bring your knee to your chest. You're going to relax your foot. You're going to extend the knee. You're going to dorsiflex. It's not about how fast you do this. As you do this, you might feel slowly as repetitions go by, you're going to do about 15 repetitions, nice and controlled. It's not how far you get your knee to your chest. It's your ability to start unwrinkling that sheath that is causing some of the nerve pain into the leg. So this is the first nerve glide. You're just trying to extend the knee, dorsiflex. Bring the knee back to your chest, which is hip flexion. So hip flexion, knee extension, dorsiflexion. Plantar flexion, knee flexion, hip flexion. Hip extension, knee extension, dorsiflexion. Plantar flexion, knee flexion, hip flexion. Hip extension, knee extension, dorsiflexion. Plantar flexion, knee flexion, hip flexion. And that's the first one. So we're just really slowly trying to take the symptoms out of that nerve. And this is your first nerve glide. Very simple. It's not about aggression. It's about technique and eliminating that nerve pain. Nerve glide 2. You will need a towel. The idea with the towel is to bring the hip into about 90 degrees hip flexion. So if this is 0, this is 90 degrees. Once you're in this position, you're going to maintain that femur in this position. Your foot is nice and relaxed. But when you extend the knee, you go into dorsiflex. And then you're going to relax the foot into plantar flexion, knee flexion. Knee extension, dorsiflexion. Plantar flexion, knee flexion. Dorsiflexion, knee extension. Plantar flexion, knee flexion. Knee extension, dorsiflexion. So if you're relatively tight, as you extend the knee, your leg might go down. So that's the idea of the towel. The towel is to maintain that 90-degree angle. More is not better, but it is a progression. Once you feel this 90-degree angle is relatively non-symptomatic and you feel sciatic relief, then you start bringing the knee or hip flexion closer to your chest. Then you start extending the knee, dorsiflexion, plantar flexion, knee flexion. But you want to start at lower ranges. Make sure you're really comfy. So we're hip flexion, 90 degrees. Knee is flexed. So knee extending, dorsiflexing. Not spending any time. These are about repetitive, controlled. You're eliminating that sheath that's compressed. Knee flexion, plantar flexion. Knee extension, dorsiflexion. Plantar flexion, knee flexion, hip flexion. knee extension, dorsiflexion. And that's it. Very simple, very effective in non-invasive. It should be done daily. If you have time, you could do this multiple times throughout the day. It's not about how fast you do this. You don't want to sacrifice range. You really want to make sure can you get that knee straight? Can you have dorsiflexion? And then relax the knee going down, which is knee flexion. And then my foot's relaxed. I point my toe up as I try to knee extend. And if you're really symptomatic, you might be getting, you might stop short of that full extending of the knee, and that's okay. But ultimately, you should be able to get that knee fully extended and point towards yourself, which will attack all that sciatic nerve. Nerve Glide 3. This one is relatively different, and you want to progress this as 1, 2, and 3. So you wouldn't want to start with this one because this is like a hierarchy, level 1, 2, and 3. If you feel good with 1, then progress to 2. If you feel good with 2, progress to 3. They all should be relatively done 15, 20 repetitions, especially that side that's having that radicopathy, which is, once again, fancy term, which is nerve tingling, that's from the low back down to the leg, and just it's all relative how low it's going to somebody. So this one requires you to be seated, but also requires your feet to kind of be dangling off the ground. So my body's flexed. So from my skull to my lumbar spine, I'm flexed. And what I'm going to try to do is I'm going to try to extend my knee. I'm going to point my toes up, and then I'm going to try to extend my whole body and try to look up toward the ceiling. I'm going to let gravity lead you back down. I don't want to aggressively flex, but I want to be flexed through the whole spine, head, and then it starts flexion. And then I extend my knees as I try to extend my whole spine, my head, and then relax. 2. Shoulders back. 3. Knees extend the whole spine, extend the head, try to see the ceiling. Keep it relatively what your body allows you to do. So as repetitions go by, you will get more range of motion. You will get this tingling and numbness coming back and localized to the root cause of where it's coming from. So once again, you're seated. Seat is going to force you to flex. You're holding on. Knee extending. Spine extending. Skull extending. And then let gravity lead you down. Extend. Lead you down. Extend the knees. Extend the spine. Lead you down. And those are the 3 nerve glides. Like I said, the recommendation is daily. You need to get rid of that tingling numbness out of the leg and get it back and localize into the low back. Once you get into the low back and it stays there, that is a totally different phase where you need to attack pelvic stability, lumbar stability, psoas flexibility, bug engagement, and lower abdominal strengthening. I will create another video for that section. I hope you guys enjoyed the nerve glide video that somebody asked me to create because they're having nerve pain. Please like, share, subscribe. Helps the algorithm. Also, in the comment section, please check out the Patreon and also follow the gram. Any comments and please leave any comments or topics for future videos. And thank you for watching.